In this video, I will share my thoughts regarding postpartum depression, the clinical signs and when to report, who can help, and how to seek help if in crisis. The mother's mental and emotional state after delivery is very fragile, so let's talk about it. Hello, parents and caregivers. Welcome to Mother Baby Central. This is Nurse Cherry, and this channel is all about mom's care during pregnancy and postpartum, and babies during newborn stage and the first year of life. Postpartum depression affects anyone. It doesn't favor a specific age group, race, or the number of pregnancies a woman had. There are contributing factors though, like history of depression, ineffective coping mechanism, lack of support, additional stress in life, financial problems, hormonal changes, and having a baby who cries a lot or with some sort of medical condition. First, let's talk about statistics. The average number of women affected with postpartum depression is around 15%, about 1 out of 7 women. Quite common if you think about it. Here's my 2 cents about that. I feel like the percentage of women who have this condition is a lot more than 15%. Why? Because I believe a good number of women don't report their symptoms to their doctor. As a woman, I feel like we don't take time to think about our own well being, especially after giving birth to our newborn baby. We feel that we should just be happy and ignore our feelings of sadness. Sometimes we think these feelings are fleeting and will eventually disappear. We don't want to make a big deal about these strange feelings or behaviors, or we rationalize it in such a way that, oh, this is normal because from what I read, the levels of hormones drop to normal levels, causing the mood swings. Well, it is true. So let's talk about these hormones and what the role is in postpartum depression. After a woman gives birth, there are a lot of physiologic changes happening. One example is the sudden drop of the hormones, estrogen and progesterone, to normal levels after the baby's birth. When a woman is pregnant, these hormones are at high levels, as they should, because they support pregnancy. Estrogen helps in the growth of the uterus, it helps keeps you pregnant, and aids in the development of the fetal organs, while the progesterone acts as a natural antidepressant. It helps stabilize the mood swings and anxiety and helps prevent contractions while the uterus is getting bigger in size. After giving birth, both levels drop, causing disturbance in one's mood and affect. Now, I also feel that the experience during the labor and delivery creates an impact on the days following. A woman's body is physically challenged during the birth process. The body has to recover, and for that to happen, it involves lots of rest, sleep, and proper nutrition in order for the body to heal. We need to cater to our basic needs first, right? Unfortunately, the odds of you having all the necessary actions to recuperate is slim because now you're responsible for the care of a tiny human being who needs to eat every 3 hours, day in and day out, who needs to be cuddled when crying, who needs to have diaper changes as needed, who needs our presence to fulfill all the needs to thrive and survive. All these demands can create anxiety and exhaustion if you don't sleep enough, eat a well balanced diet, and have a little me time. It can push you to the edge. If you don't have good family support, you can get overwhelmed. If you don't ask for help, it can take a toll on you and you might eventually break. Therefore, the support of your significant other, family, and friends is critical in your well being and sanity. Now, let's talk about the symptoms. The screening tool you typically answer in the hospital or the doctor's office is only that, a screening tool. It is not meant to give a diagnosis, but it's one of the tools the doctor uses to figure out what is going on with you. So it will be very helpful if you willingly report any of these symptoms that persist for more than 2 weeks to your doctor. What are these feelings? Feeling sad most of the time, severely anxious and panicky, does not find joy in life or even in little things, shows no interest in anything, constantly fatigued, has poor appetite, or eats too much, leading to extreme weight changes, indecisiveness, poor concentration, inability to bond with the baby, isolating yourself from friends and family, poor hygiene, and thoughts of harming yourself or the baby. Your significant other is probably the first person to notice that something is off. I cannot stress enough the importance of support from your partner or someone like a close friend to always check on your well being. Who can help? Your OB doctor is the first point of contact to report your symptoms. If you are beyond the postpartum period or it has been like 6 to 8 weeks after having your baby, then you can go to your PCP or primary care provider. Your baby probably goes to regular visits to the doctor too, so you can also mention your symptoms to your baby's pediatrician. All these doctors can refer you to a mental health specialist like a psychiatrist, a psychologist, or a mental health nurse practitioner. Postpartum depression is a disease and it is treatable. The earlier you seek treatment, the better outcome it will be. If you don't have any support at home and you feel like hurting yourself or your baby, please call these numbers immediately. This information can be found on the CBC website, but I will be sharing it here for your resource. Call 911 or you can call or text 988. You also have the option to chat with a crisis counselor at 988lifeline.org. They are available 24 hours a day and 7 days a week. Or call or text 1-833-943-5746. This number is the maternal mental health hotline, and they have a Spanish speaking person to help you if you don't speak English. Mental health should be one of our top priorities. Entering motherhood is a unique experience for every woman. Unfortunately, postpartum depression can be one of those. We cannot assume everyone always finds joy after a baby's birth. Moms, there is no shame in admitting there is a problem. Seek help, get treatment, take care of yourself. And there you go, moms and dads, my thoughts on postpartum depression. If you find value in our topic for the week, please hit the like button and share it with your friends. And if you want to get regular content, consider hitting the subscribe button. Be well, everyone. Make this day count, and happy watching.